Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you for joining us today. Our guest in studio today is 2015 American Heart Association Physician of the Year, Dr. Lori Mosca, in studio with us as a returning guest to talk about how patients can better manage their condition to prevent that second heart attack, and some others trying to prevent that first one. Welcome to the program, Dr. Mosca.
Thanks for having me back, Neal.
Thanks for coming back, Lori. You know, we talked in other segments about some of the strategies for preventive cardiologic issues. We also talked about some of the side effects of daily aspirin therapy in other segments. Today, we'd like to talk about some of the responsibilities that patients have in managing their own condition. Becoming a candidate for a heart attack takes years and years of a certain lifestyle, a certain diet, maybe exercise, or sometimes too much exercise. Who knows? When it comes to the responsibility of the patient, let's talk about how we can help you help us.
Well, that's important because I do think it is a team-based approach to optimizing one's health. Certainly, there's a lot that we can do as healthcare providers, therapies that we can offer patients, but it also is important that patients are empowered to really take charge of their own health. Mm-hmm. And I always start off that conversation with patients just making sure that, we do a sort of a general scan of their bodies, talk to them about getting regular checkups, committing to the time that it takes to focus on their own health. So that, sometimes I call it the 50,000-mile checkup when somebody's turning 50, or the 60,000-mile checkup when they're turning 60, and to really have them almost give themselves a birthday present, to just go through a list of what are my risk factors for different conditions, what am I doing actively to try to live a long life and a healthy life, because I think people want energy and they want to feel well just as much as they want to live long. So I talk to the patient about what are their goals and what are they doing to try to maximize the results that they're looking for.
Is a risk factor period, or are there some factors that, the patient might want to hold on to, yet full well that if they hold on to that one, it's just as bad as holding on to them all?
Well, what you just said is right. I mean, a risk factor is a risk factor. It doesn't mean that you definitely have a disease or are definitely going to have a recurrent event. Mm-hmm. I always think back to Yogi Berra. Prediction is difficult, especially about the future. Yeah. So you can take preventive action to try to really alter future probabilities. And so I think putting that back in the patient's court, that this is not necessarily a done deal, it's not definitive, that you have power to really change your future, how you're going to feel, how long you're going to live, and engage them more and help to inform the patient. In years past, we doctors were put on pedestals and patients were afraid to ask us questions, and that's changing, and that's a good thing. I encourage my patients, I encourage everybody, go to your doctor with a list of questions. Make sure you know about yourself. What is your blood pressure? What is your cholesterol level? What is your waist size? What's the likelihood that you're going to develop a recurrent heart attack? And have that conversation.
You mentioned that paradigm is changing, where you guys are on a pedestal and we see all the things on the wall in your office, and we're like, hey, I don't, we bow down. That's changing. But it's more because of what the physicians, it's your approach to the patient, I believe, more so than the patient going out there and becoming all of a sudden this empowered patient. How do you, as a healthcare professional, tell other healthcare professionals how to empower someone who's maybe a little bit reluctant to empowerment?
Well, and that's a great point you just brought up, too. We should really keep in mind that there are still many, many individuals that feel marginalized by the healthcare system. And these are often, unfortunately, the patients who are at highest risk of developing heart disease, those who are have the lowest levels of education. They may be depressed. They're on multiple medications. They're elderly. They're frail. these are the individuals that I worry about, but these are the ones that need the most empowerment. And what I suggest in that situation is to engage caregivers. I've always taken very much a family-centered approach to the prevention of chronic diseases. And because it's hard, even when you're just trying to live a healthy lifestyle, if you live in your own culture, and in the culture in your house and the culture at work is working against you, these toxic environments can make it very difficult to be empowered, to make healthy choices. So I often bring in key stakeholders in your life to help engage them in the process of prevention. I mean, we've actually developed contracts, prevention partners, we called them in my clinic in years past, because it is difficult to do on your own, especially these individuals that are marginalized, the features that I just talked about.
What, in your opinion, can healthcare professionals, say the specialist, learn from the first line of defense, the nurses that see your patients first? Oftentimes, that guy that's 65, maybe 70, has such a rapport with the person that's going to take his blood pressure, and then it seems to change once they're in the office. What can you learn from the nurses?
Oh, you're absolutely on the money with that one. In fact, I went so far as to I had a dietitian work with me in my preventive cardiology clinic for 20 years. The patient first saw a nurse or a dietitian or both. And they would then come to talk to me after they triaged the patient and gave me a heads up on where the patient's at. Because you know what? The patients will often disclose to nurses or dietitians, to individuals other than the physician, many things that they won't disclose to us. And I think sometimes it's because they feel more comfortable, they have more time, but also I think there's this hidden thing about to not really disappoint the doctor. I've really felt that. I felt that my patients don't always want to come clean with me, because they don't want to disappoint me. So I try to make it easier for them by that first line of defense, as you put it, Neal, having them have some of that conversation, come talk to me before I go in to see the patient. And my recommendation is, when you go in there, and this environment we have now with electronic medical records makes it very difficult. Look the patient in the eye, take a deep breath, and ask them, how are you doing? No, really, how are you doing? And bring up some factors. My dietitian told me that, your daughter's getting married and you're trying to lose some weight, and how can I help you achieve that goal? So I think just look for little windows of opportunity and what's going on in the patient's life to try to help re-engage them in activities that are very difficult, such as prevention and medication adherence.
When you're speaking to folks and putting out some of this new information, when you're talking to someone one on one, and you see that they're a little resistant to some of the newfangled things, as it were.
Well, I've been involved in developing national guidelines for prevention for 2 decades, and I can say that I've heard it all, I've seen it all, I understand the resistance, and I've learned that we're not always right, and doctors often have concerns that are very genuine and valid, and I think it's important to remain very open-minded and to ask them, what is their experience? Why do they maybe not want to try something new? What are their concerns? And I find the best solution to fears, and we all have fears even as doctors, is data. Show me the data. Because we do have anecdotal experiences, but collectively, when we look at the data, I think that's the most powerful knowledge that we can really share with each other.
Great. You've been listening to Health Professional Radio. I'm your host, Neal Howard, in studio with Dr. Lori Mosca, noted cardiologist, researcher, and preventative cardiology leader, in studio this afternoon talking with us about how we as patients can take a little bit of control of our condition and help our physicians help us more effectively. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.